Whey protein has unexpected benefits that nobody is telling you about, but only if you know how to use it properly. Have you heard claims that whey protein harms kidneys, raises cholesterol, isn't natural, or is useless without exercise? I'm Dr. Bora Bandera, an endocrinology and nutrition specialist. Today I'll show you how to use this functional food to improve cholesterol, triglycerides, blood pressure, and glucose. In less than 15 minutes today, you have the following menu. First, what is whey protein? Second, how does it improve your lipids? How does it lower blood pressure, control glucose? And finally, I'll share the right guideline, time of day, and a checklist so you can choose the best whey protein according to your goals. What is whey protein and why is it so interesting? Whey protein is a blend of proteins that comes from milk whey, which is nothing more than the translucent liquid obtained as a byproduct during cheese production. In this process, the casein curdles on one side and the whey remains on the other. Therefore, there are two main groups of proteins in milk, whey and casein, and in fact, casein is the most abundant. And from a biochemical point of view, whey is not a single protein called whey protein, but rather a collection of proteins. We have beta-lactoglobulin, which makes up more than half, and alpha-lactalbumin, which makes up a quarter. We also have smaller fractions of immunoglobulins. Immunoglobulin G, immunoglobulin A, immunoglobulin M, comprising about 10% plus minor ones like lactoferrin or bioactive peptides with immunological activity. That's why it's considered functional. More on this later. But why is this protein so famous in the field of sports nutrition and more recently in the world of health? Well, it contains all 9 essential amino acids that also reach your bloodstream quickly. This is what we call high bioavailability. And besides, it's very rich in leucine. What makes leucine special as an amino acid? It's the primary signal that triggers muscle protein synthesis via leucine. Because of all this, many authors refuse to keep considering whey protein as a supplement and see it more as a functional food. A food with beneficial properties for your health when consumed properly. Now let's look at some unexpected properties. Whey protein may improve cholesterol and triglycerides. It began strong, citing a meta-analysis of 65 trials with 3,822 adults. This evaluated dairy protein supplements compared to placebo or no intervention with doses of 30 to 60 grams per day for 2 to 24 weeks. Modest but consistent improvements were observed. Total cholesterol dropped by about 4 mcDL and triglycerides by about 6 mcDL. And systolic blood pressure, about 2 millimeters of mercury lower. The effect was stronger with whey protein than casein, especially in people with high lipids or metabolic syndrome. The practical translation is simple. They are small individual changes that are positive, cumulative, and safe when maintained along with a proper diet and exercise. Let's debunk a myth. Cholesterol drops because it leads to less weight gain than the proteins it replaces. Eating whey protein instead of chorizo helps, but it's only partly true that everything will be fine. There are mechanisms specific to whey, which we'll talk about in a minute, that justify these benefits. But before that, let me ask you, do you have high blood pressure or do you know someone who does? Then pay attention. In a 6-week randomized trial of 97 adults with grade 1 primary hypertension, 50 grams of whey daily in 200 milliliters of water lowered blood pressure more than maltodextrin. Look at the diastolic. The lower one dropped from 93 to 80 millimeters of mercury, and the systolic, the upper one, from 150 to 131 millimeters of mercury. We went from discussing hypertension to near normal numbers in just 6 weeks. If you want to learn how to lower your blood pressure naturally, I'll share this recent live session with Dr. Veller, a cardiologist, which is worth watching. Keep in mind these studies use isolated or concentrated serum, without added sugar, taken as a drink and usually dissolved in water, not combined with sugars, sweeteners, or other caloric drinks. This distinction matters. Note that the comparator in this study is maltodextrin, a source. High in carbohydrates that doesn't do much good for sedentary people and those with metabolic disorders. Of course, it's not easy to match whey protein with a similar non-caloric product. I just mentioned isolate and concentrate, and you might not know what I'm talking about. Remember that at the end of the video, I'll give you a checklist to choose a good whey protein in less than a minute. There are 11 steps that I don't want you to miss. What about blood sugar? And what if whey protein was the new apple cider vinegar? Remember, to regulate postprandial glucose. In this crossover trial, pregnant women between the 20th and 36th week of gestation drinking whey before a meal improved blood glucose half an hour after eating. 12 of the 24 women in the study had gestational diabetes, a glucose metabolism disorder that develops during pregnancy. The participants took 20 grams of whey or a placebo 30 minutes before an oral glucose tolerance test, and afterwards, for the next 5 days. They wore a glucose monitor and took 10, 15, 20, or 30 grams of whey 30 minutes before their standardized breakfast each day. What happened and what were the conclusions? Well, during the oral glucose tolerance test, whey reduced the glucose peak by between 13 and 18 milligrams per deciliter, and the average levels throughout the test by 5 milligrams per deciliter. This only occurred in women with gestational diabetes, not in healthy ones. What's the idea? Well, that preloading with 15 to 30 grams of whey protein half an hour before the most glycemic meal of the day, it can reduce glucose spikes in people with postprandial hyperglycemia, insulin resistance, or those needing better blood sugar control. If you follow this channel, you want to know the reasons behind things. Same here. So then, why does it work like that? If what you knew until now was that only protein could improve muscle, help you gain more muscle, and so on. Well, these are the mechanisms. Taking whey protein has an effect on incretins and insulin. Whey, high in leucine and bioactive peptides, boosts glucagon-like peptide 1 and glucose-dependent insulinotropic polypeptide and affects pancreatic insulin secretion. This smooths the glycemic curve and improves the signal of this hormone in adipose tissue and muscle. In addition, by activating glucagon-like peptide 1 and glucose-dependent insulinotropic polypeptide, it greatly increases satiety, which results in a lower total daily caloric intake due to that satiating effect. That's why it aids body recomposition and helps maintain a caloric deficit. It also helps prevent sarcopenia in older adults, even without physical exercise. It can also lower your cardiovascular risk by reducing factors like blood pressure, dyslipidemia, or metabolic issues linked to obesity. But you have to use it correctly. You can't use it randomly or sporadically. Let's get practical. We've always viewed whey protein as a way to boost muscle mass. Most athletes take it after training, but this isn't as important as people once thought. But to get the cardiometabolic benefits we've mentioned today in the video, there's not just one valid way. In other words, each goal has its own way. To improve cholesterol and lipids, aim for 32 ounces per day, split into 2 servings, for example in the morning and afternoon. To reduce glucose spikes or improve glycemic control, take it 20-30 minutes before your highest glycemic load meal. Sunday paella, for example. Tip: pair your meal with fiber and healthy fats to boost the effect. If your goal is muscle, take it after training or with your lowest protein meal of the day. Now I'll help you pick the best one. What should you consider? Here's an 11-point checklist for choosing the best whey protein. First, distinguish between concentrate, isolate, or hydrolyzed. They differ in processing level, protein, lactose, fats, and of course, price. The concentrate has less protein, more lactose and fat, but is cheaper. The hydrolyzed one is pre-digested, directly providing the protein peptides. It digests better but tastes worse, is bitter, and costs more. For most people who don't have a serious digestive condition, I would choose an isolate, which is the most balanced intermediate option, and it's the one I personally take. Second, look for reputable raw material suppliers, such as Fonterra, Arla, or Volac. Third, look for CFM extraction methods, which means cold cross-flow microfiltration. This preserves the integrity of the bioactive protein fractions without denaturing them. This must be met for it to be a functional food, otherwise it won't be. The protein to serving ratio is high, calculated by dividing protein grams by serving size and multiplying by 100. A concentrate should exceed 75-80%, an isolate at least 90%. Fifth, check the leucine dose. Ensure each serving contains at least 2.5 to 3 grams of leucine. Sixth, a short list of ingredients. Ideally, it should be concentrated whey protein, isolate, and a natural flavor. It may contain sucralose and an emulsifier, but nothing else. Seventh, be suspicious of amino spiking when you see free glycine or taurine in the list of ingredients. Be careful, this is done to falsify total protein content, which reflects very badly on the brand. Eighth, stevia and sucralose are 2 top sweeteners. I always recommend neutral flavors without sweeteners, like the native isolate from Full Gas I use. Honestly, I dislike the flavors. Secondary ones, because it really reminds you that you're having food, not dessert. Get used to not having flavor. Kinder Nutella cookie. Ninth, as an emulsifier, sunflower lecithin is fine if effective. 10th, it shouldn't have maltodextrins, excess vegetable oils, or thickeners. The simpler, the better. And 11. Brand reputation. It's known for its quality, transparency, and care for its product. And now guys, I'm signing off. Thank you for your attention. Thank you for watching this video. See you in the next one. A big hug, and let's keep empowering each other.